Expose the orbit and pterygopalatine fossa to take a look at the deep vessels and nerves of the head. In some cases, the decision is to dissect the left side where the temporalis muscle has already been removed and to keep the right side intact. It's mainly because many superficial structures, including the nerves and temporalis muscle, are susceptible to removal during dissection. Follow the instructions of the faculties as to which side will be dissected. The right side will be used for the dissection. Perform the dorsal midline incision on the auricular muscles, like on the left side.